Wayne will be well known to many of the people here today from the biobanking community. He's been involved in biobanking for many years. He started his career in biobanking at the Concert Biobank here in Sydney, where Concert was one of the Cancer Institute New South Wales Translational Cancer Research Centres. Wayne, after completing his PhD, he took his current role as General Manager of the Victorian Cancer Biobank, and more recently he's been elected as the Indo-Pacific Rim Regional Ambassador for ISBER. So ISBER, of course, being the International Society for Biological and Environmental Repositories. So Wayne's role through ISBER is about connecting regional biobanking initiatives to the largest biobanking worldwide forum. And today Wayne's going to be talking to us about his own vision for the promotion of biobanking in our region and how biobankers across the Indo-Pacific can become more involved in ISBER activities. So just a reminder, if people could stay on mute because we'll be recording this seminar. If you'd like to add questions to the chat, you'd be very welcome to do that. We can read those out at the end, or we can also just ask people to jump off mute at the end, and you'd be very welcome to answer questions. But thank you again, Wayne. We're really looking forward to your seminar. Thanks for your time.
Thanks, Jenny, and thanks everyone for joining this meeting, and really thank you for the very kind welcome. So before I begin, I would also like to acknowledge the country, the traditional owners and custodians of the land and waterways on which we are meeting from today. For where I am is the Boon Wurrung people of the Kulin Nations, and pay my respects to the elders past and present and those who are emerging. I extend my respect to the Aboriginal and Torres Strait Islander people who are also present today. Thank you. I hope everyone can see my slide clearly. Do let me know if you have any questions. As what JD said, there will also be questions time at the end as well. Just a bit of disclaimer, there is no known conflict of interest for this presentation today. Thank you. So just an overview about the talk today. I guess given this opportunity, I will probably be sharing some of the personal journey I have with biobanking as a career and also ISBER, which I think Jenny has kind of very nicely articulated that out already, but probably a bit of more of my take, as well as hopefully that will be inspiring some of the some newer generations of biobankers as well. There will be about some brief introductions of what ISBER is, and also just in case there's new joiners of not knowing too much about that. Also the region ambassadors for the Indo-Pacific regions of ISBER. Then I'm going to be having a brief discussions on the ISBER and also biobanking landscapes in the Indo-Pacific region that I would like to share, and some of the upcoming plans that as a role as the director at large for the Indo-Pacific regions of the ISBER. Thank you. So bear with me, I was surprised with how my team members make this very nice chart or timeline of my career and also my sort of qualifications background. So I'm originally, or I'm a molecular scientist by profession. So I had my undergrad and the masters in the UK, University of Nottingham, and I had my PhD at in Western Sydney University. So that's where I also started during my PhD candidature. I started my first biobanking job as a technical officer at the Concert Biobank and led to being the assistant manager over at the Concert Biobank. So I have quite a strong link to, as always, a cancer person and also in the biobanking as well. I didn't have that long of biobanking career, although I can't really say I'm new anymore. So it's been 2016 to now. Then I had an opportunity. Sorry, yeah, I always forgot about this animation. And then So, and I joined Victorian Cancer Biobank a couple of years ago, just right a year before COVID. So, I had an opportunity to move to Melbourne and then starting here. And also in the same year, I was appointed by the National Institutes of Health Malaysia as the advisor for that year to sort of provide some advice on how they could form a sort of biobanking initiatives as a national framework. So until today, I'm still with the Victorian Cancer Biobank, obviously now, and has taken up a few more leadership roles as one of our favorite Australasian Biospecimen Network Association, and also the steering committee for the Australian Donations and Transplantations Biobank. Oops. So this is just a bit of a brief introductions, really just very brief. Victorian Cancer Biobank is a consortium, so we basically work as a partnership with 5 major hospitals in Melbourne. We collect, and provide mostly cancer biospecimens to researchers across the country to support any kind of cancer research that will improve their health outcome. So these are the teams across the whole consortium. So some of them are based at different hospitals and so on. So we had an opportunity to have a nice communications workshop last year, which is where this photo is based. You could see that I deliberately leave out any ISBER reference here because then I have my journey with the ISBER. I guess probably not uncommon to many of us who started biobanking role, as you could see from my previous journey. What I shared is, we started off from somewhere else and then gets into biobanking. And the first thing I really know and learn about ISBER, probably similar to many of you, are the best practices, because we probably always got lost when we started the biobanking and what do we do, what are we going to, how do we going to apply our SOPs and stuff like that. So in 2016, when I started my biobanking career, best practices has been one of my to-go book references all the time. That's how I learned about that. With that, I was very fortunate in 2018, attended my first ISBER annual meeting in Dallas. And that was also, I had a lot of first time there because that was also my first time in the US. And having to go through all those hurdles of visas and stuff like that. But the conference has been very eye-opening, and that's how I learned a lot of international contacts and around biobanking. That's also where I'm not sure if Dan Catchpool or Helen Siniski is here. Are they here? Because that's where I also met them. I haven't met them in person in Australia, but I actually met them in USA. I also had a lot of fun time. So the good things about attending conferences is the networking doesn't stop after the conference or after the work. But I also attended the conference dinner, which there was a very nice conference dinner that was because it's in Dallas, Texas. So they showcase with some games on the Cowboys. So I actually did that with a bunch of biobankers, and then we also did some chicken dance during the conference dinner. So it was a very nice way, and I made a new great friends during the conference dinner just by itself as well. So being a new joiner at that time, I think I was very grateful that albeit I was able to enjoy and also I learned a lot from the ISBER. And following that, I was very again fortunate to be able to be joining the ISBER, getting more involved in that as the regional ambassador for the Indo-Pacific region since 2019 until I recently got elected again. And also I went to the annual meeting in Shanghai. Unfortunately, I don't have any photo. Maybe someone would share. That's where I also met a lot of the Australian colleagues together, and getting, we had dinner and stuff like that, as well as a lot of the very good discussions of biobanking. And obviously COVID hit, so all kinds of in-person meetings stops, but I was sort of also, obviously I was involved in chairing one of the town hall sessions in addressing or discussing some of the, at that time was like, how do we respond to COVID as biobanker? How do we contribute? So which were lucky. And then had some roundtable discussions with all my regional colleagues and also international colleagues. And then fast forward 2022, the first in-person meeting came back. So I was again fortunate to be the invited speaker to speak sort of on behalf to sort of articulate a bit of how our biobanking systems here in Australia. And then also I managed to grab one of my team members, Duncan. By the way, Duncan is the whole contributors of all these very pretty slides. So he helped me with doing all this very pretty slides. So thank you for that. And leading to so this year I was again elected, as I mentioned, now the director at large of the for the Indo-Pacific region. So these are the coming years I'm hoping to have more contributions towards the biobanking community, especially in the regions and obviously Australasia as well. We were fortunate again to attend the annual meeting, and this time I was chairing the plenary sessions of that conference, and as you can see, a lot of familiar faces already on the photos. We had dinner together, and also with and sharing sessions together as well. There's a lot of Australasians, I would say, representations there. And moving forward, obviously there's a lot more involvements I will be really sharing today, but a sneak peek is obviously Melbourne is where ISBER is coming next year, so I will do a bit more advertisement later. Thank you. So now I guess is back to the square one, just for maybe some of you who are new, who doesn't know much about ISBER. So who we are really. I guess before I say anything, I guess is probably provide a bit of a longer name of ISBER. So ISBER is an acronym for International Society for Biological and Environmental Repository. So it's I would safely say that's one of the largest biobanking forums globally to connect everyone together with the visions to be leading network, the leading network in global biobanking and biorepository community. And also the mission is to advance the expertise and quality of biorepository and biobanking science worldwide. Okay. There are a number of tools that are part of the portfolios of ISBER. So ISBER has sort of move into a phase where we try to develop ISBER products so to really make it beneficial to the community. So obviously, most of you would be quite familiar with the ISBER best practices. The good news is that the 5th edition is coming. I think it will be released very soon. So stay tuned with that. I think there is quite a major writing in this one to really include a lot of the topical topics that we have as the modern biobanking, I would say. There are also others for more like essentials of biobanking. It's more training tools and proficiency tests and some of the qualifications people can take on, and also the self-biobank assessment tools. There's some of them obviously complimentary, some of them are obviously has a fee. So feel free to go onto the website. They're all on the website for you, readily for you to explore. So I guess I'm using this slide to sort of introduce a bit of structures how the ISBER is like, and also another way to introduce to you how you can actually get involved. So ISBER is being managed by a professional management company called Malachite. But other than that, the whole ISBER is really a voluntary work. Everyone's involved and with their passions of the biobanking community, I would say. So obviously we have the board members. So the boards, including myself, so it's to kind of drive the directions of where ISBER is going. Then we have the community of practices, where we have the 3 key one now is the standards, educations and training, and also the science policy. So I think Sam Higgins, which some of you probably know who she is. She's the vice chair for the standards committee. While Helen Marine from New Zealand is the chair for the science policy. There's also special interest groups such as I think it's the childhood disease interest group, and also the pharmaceutical interest group, and there's others as well that people join in to have a more specific topics, discussions, and engagement. Task forces, so they're usually based on one of the key they're established for establishing some tasks. So one of them being the conference program organizing task force, which currently we have the one for Melbourne, and also for me, I'm the chair. I'm chairing the local engagement task force to organize events for the ISBER Melbourne next year. Another ones that I will work very closely with is the regional ambassadors. So we'll probably speak a little bit more later. And also, obviously, most of you are welcome to attend the conferences, symposiums, webinars, or even be a speaker or so. Thank you. Now, just a bit of zoom into Indo-Pacific region. So I'm going to lead to these are the sort of coverage we have. So basically, the ISBER is trying to obviously cover the whole global in 4 different regions, which include the American continents, the Europe and African continents, and then Indo-Pacific region, and then China. So we are very fortunate to have about 6 regional ambassadors now, and they're spanning distributed across the whole Indo-Pacific region, including Bushra from Pakistan, Birendra from India, Han from Vietnam, Yaya from Indonesia, and Tazaki from Japan, and obviously our very well-known Anusha. I'm not sure whether she can join today, but yeah, she's the newly joined region ambassador. So, which gives quite a good representations over the whole regions that we can all work together. So their roles basically is kind of work with me, more like, I wouldn't say support me, but actually we work together in increasing the the visibility of ISBER across different regions and across this region, and also bringing in topics of their interest to the ISBER so that we are aware that we can sort of contribute to those needs in this region. Okay. With that, I'm going to move on to really talk a little bit about the landscapes of biobanking in this region. Just to declare that a lot of this information is more of either a personal view or a snapshot, a bit of a sneak peek view. So it may not represent the full scope of what we have here, which I think we all work together to wanting to explore more. I'm very humbly to say, as much as we think we know a fair bit about biobanking, and you always get surprised with how much we don't know when we try to talk to different people, and there's so many different types, as we all appreciate. But I believe that sort of difference and diversities really sort of make us unique, that we can really work together and embrace each other together. I actually decided to put this term hidden gem. So for IPR region is in the biobanking world, Indo-Pacific region is one of big hidden gem that there's a lot to explore and a lot that we can offer. The reason why I'm saying that, I guess you probably heard about a term that most of the treatment nowadays is being tested on generally white, what do you call it? White male in Western world. So a recent study that was done by this group shows that 86% of our genomic studies that was done in 2021 are from the individuals from European descent. And for East Asian, Africans, and the others are really only small portions of all these genomic studies, where, obviously all these studies are closely related to what biobanking are doing. So that means that there's a lot more potentials in the Indo-Pacific regions where we can offer as part of the East Asian and also the South Asian and Southeast Asian as well, to really boost this number up to improve that sort of diversity, that sense. Coming back to ISBER, so just to show you a bit of the memberships in this region, we are on the 3rd on that ranking. It's not trying to compete or whatsoever. It's just, in reality, this is the number, and I think of these 101 members in the region, I think gladly, I think we have 36 that are Australian, but we obviously want to aim to have more and improve the the whole Southeast Asian regions and the other regions to have more members to be representing the region. We also have partners, so we work with the partners, and obviously one of them, do you really know, is to Australia, the ABNA associations, and we do work with the Asian Network of Research Resource Centre, the Biobank India Foundations, and also the ISBER. I think one of the key is not trying to reinvent the wheel. I think we want to work closer with the partners which already have formed a strong and nice network, and for ISBER is to work with them and understanding the needs of that region. Okay, so as I mentioned, very often we don't know much about biobanking in the region unless we sort of start knowing some people, the people from that region and so on. So I'm fortunate to know a few of the biobankers in this region. So I actually sent a short Q&A just last week. I was really have to thank them for actually having such a short turnaround time and send it back to me about what they think about the biobanking in their country. And also, I'm also going to present you with some sort of very high-level topics on the interview and surveys that was conducted, I think, last year in preparations for the regional and strategies that we're going to work on for at the ISBER level. So it's really trying to provide you a little bit of understanding of how is the biobanking landscapes in this region in sort of a limited capacity. I wouldn't say I know more. And a lot of, I have to say, a lot of these are based on, one or two comments. So it is represent some sort. It may not be representing the whole biobanking landscape. The questions I asked them really very simple. Is the, brief descriptions about biobanking systems in their country, the interactions of their biobanks with the research community, and the usual three strengths or features, and also the challenges. So thank you for all these four who responded to me in such a short time. They are Anusha, Yaya from Indonesia, and also Aloysius, who is a CEO of the Indonesian companies working with the Indonesian government, and also Ing, who is one of the key figure of biobanking in Singapore. The map shows you also include those responders on the interviews and the surveys that we have done for the ISBER part. Okay. So so according to Anisha, so this is some sort of I summarize what she gave me, and some of the informations are based on I think the recent surveys that ABNA has done. So I think we as in Australia, again, I think I put Australia first because it's alphabetically we are just an advantage of an A. So we have in the biobanking field, we have a rich heterogeneity across different fields, including obviously the medical research sector. We also have agriculture, rich in the botanical networks, and also zoology and the microbiome. However, there is a bit of strong feelings of about being biobanking being undervalued within the research ecosystems. There's a lot of people talk about it, but it's not really working into it. Particularly project-specific biobanks tends to have more extensive engagements with the researchers than the general infrastructure, where a lot of expressions is on that the struggle with the visibility. The interactions between biobanks and the research communities happens at varying degrees on the local level, as I presume this is not unfamiliar for most of you. In terms of Indonesia, I think what they felt is it's at the early stage of development. However, I think they have quite a significant growth in the past few years and starting to really gain a very strong interest from the governments to support what they want to do in creating a strong framework for the Indonesia. we all know how unique and large populations of the Indonesia as a country. So there is a lot of massive potential, especially when we talk about that sort of inequality in the genomics or any other information. So I think they do have a massive potentials in revisionize or improve this equality that, we want to improve the health outcomes in that country as well. And in supporting obviously the research. In terms of working with the industry, they have limited interactions at the moment, but the interests are really growing. They really want to work together with industry and also academics together to form that sort of ecosystems that will boost the economy and also improve the health outcomes the people. As a low-income country, obviously they work with very limited resources. So where I think it's probably not uncommon for many of us, but I think they probably in a particular way that they really need more support in that sense. And also they're working as in fragmented environments where biobanking is quite silos and do their own things. Therefore, they really emphasize on needing more educations and trainings in that sense, to harmonize or standardize the workflow. Also, the significant requirements on coordinations to improve the ecosystem. Singapore, while on the other hand, has two key strong initial things happening over there that I think that really allows the whole coordinations and the biobanking to really work closely with researchers. So first is the implementation of the legislations that really on handling of human tissues for the use in research. So that includes clear descriptions on roles and responsibility for whoever who are dealing with human tissues. So it's kind of regulating how people should do things in the human tissues for research. At the same time, they have also formed a consortium for clinical research and innovation, Singapore, called CRIS. This is a very good consortium to really bring together 6 key national R&D initiatives and clinical services to facilitate the synergistic collaborations in Singapore. And obviously one of the arm would be the biobanking. So really putting everyone's together to work on the R&D work in Singapore. So the next slide I would be talking really try my best to compile with what I think strengths and features that are common or specific across these few responses. But it's kind of still quite unique that it may not be, again, it's kind of going quite summarized. First point is really, I think what I'm glad to see is that all response came back as there is an increase in sustainability mindset, including us. So which is really trying to talk about how do we create values for biobanking, how do we create the impacts towards that, and obviously on the financial side as well. In Australia, particularly, there is a trend of remodeling for biobanking into a service-based model, which many of you would probably are doing similarly. Across all of us, all of them, we could see that there's quite a keen they're quite keen to actually have the local and international engagement. So in the sense, not just both in interacting with biobankers, but also at the same time with the researchers or the industries in really making a change for the community or the research. So which is quite good to see. Indonesia obviously have that untapped large diverse populations as the feature. And as mentioned, the Indonesia and Singapore has quite a strong government interest that they're really supporting. And in Singapore, obviously, there is that regulatory framework. Both Indonesian and Singapore, the governments actually work with the whole ecosystem to actually create or enforce the health data linkages, so to really allow more linkages across different data sets and that for really improving the research use of those. On the other hand, the challenges, I guess many of these are probably not unfamiliar for many of us. So one of obviously they may be at the different levels for different countries and regions as well. So one of the first key things obviously is most of us are still working in a slightly more fragmented or slightly more or actually strong fragmented landscapes and operations. Everyone works differently. Singapore, I would say, probably with the legislation is probably going to be less, but I think we're still working. They're still working towards. Data sharing and security is also a big challenge with the currently everyone is talking about big data. How do we make the data available for everyone to make use of them and leverage the resources? And then kicks in with the cyber incidences and stuff like that. How do we address that? So it's not just us in Australia, but I presume that's for everyone. With the fragmented landscape, obviously leads to the biobanking governance and regulations. How do we best have that in place to improve, maximize our resource for research use? Resource constraint, I think this is again across the board, where obviously I think for us in Australia, we have more on constraints on how do we consolidate, how do we leverage our resources, where in countries like Indonesia is really the basic infrastructures. How do we have a proper biobank and so on? As mentioned just now, I think the engagement research ecosystem is a challenge, and I think there's a lot more work need to be done on creating that sort of ecosystem involvement in that ecosystem. Public awareness, again, is not a surprise to us. I mean, I felt that even as in Australia, we also struggle to sort of get our words around, even though we are one of the in the research pipeline, we're one of the working people, one of the infrastructure that work closely with the people. And also there's perception still with researchers thinking biobank is just a freezer and that kind of things. How do we create more of educations to improve that sort of perceptions? So obviously Singapore uniquely has a bit of a limitations with the population size, as mentioned, but probably not so much for the Indonesia or Australia. So with that, this is really, again, a sneak peek of very simple Q&A that I asked around. I'm humbly really hoping to learn more in the future and really being able to cross-pollinate different sort of collaborations across the region. With that, this is really quickly going to share with you on the interviews and surveys, some of the I would call it like key phrases or topics that I'm eager to share of those coming out from those interviews and survey. That is, so I won't say too much about what's the detail because it's really useful. It will be part of that regional strategy. The responders obviously coming from disparate countries. I think first area is really that people are really keen is the knowledge sharing, such as best practices, the basics biobanking and science training, and knowing or exchanging knowledge about the regulations or what everyone's doing in that area, and also the ethical considerations. Everyone's probably different, but I'm quite keen to have that being discussed and shared. Sustainability is a big topic. I guess we all would agree. This is any kind of, if you're talking about new era of biobanking, sustainability is the key, is one of the keys. So there's very strong interest in wanting to have more either collaborations or discussions on this area, including sustainability at individual level, national level, or any kind of strategies to address that. And also another big area is the affordability of technologies that for biobanking to make use of to maximize our value. Cultural diversity, I guess some of this it's already been done at ISBER level, but I think how do we break the barriers such as language and the cultural that sort of understanding to really gain more knowledge sharings and the sustainability all those discussions in a way that everyone feels safe and in the environments that they could share and provide input. I feel like sometimes it's always the few groups who are discussing those topics. So I think it's really how do we make those networking less barriers for people from different cultures and so on. Similarly, inclusivity, I think they're kind of hands in hand. I guess the reason why I put that is, I mean, we want to break that. I think there's a need to break that sort of concept that, oh, is ISBER a North American focused society, or is that more inclusive? I mean, one of the areas to work on, how do we address that time zone issues where sometimes with less people coming from IPR, so obviously the time zone is going to be in favor to them, but we probably want to work on how do we make that work to have less of that being prohibitive to our region. With that, I guess you'll probably be asking, what can I do? What can we do? I mean, I always love to use the word, what can we do? But obviously in the sense of being the director at large, that's what I put as an I. But what it means that me is going to try to work with everyone, especially the region and the ambassadors to together to improve some of the areas. So this upcoming plan is a bit brief because I really just starting terms a few months ago, but I'm really keen to learn from how previously people has been doing and also improve from there. I think the first step is, as I mentioned, we are going to develop a regional and both regional and also in ISBER-wide strategic plan. So they will kind of work together. So I'm keen to be contribute to that, and then that's where we will have very solid and organizational-wide kind of strategies to address some of the needs. Obviously, we're going to work with the regional ambassadors and partners across the region to really, I think my role is there to really connect people and embrace them for diversity. So we want to connect those biobankers and also really having more educations about those biobanking initiatives in the or framework, I would say, in this region. So, some ideas would be around newsletters and webinars and or even podcasts that was told by Jenny today that so all these seminars will be on YouTube. So that's another idea that I can think of how we can improve with the visibility here. Obviously, representation, I think, is one of the key things that what I want to improve IPR. So there's two representations here in 2 points. So one is really encouraging the representations of IPR in any of the ISBER community, those standards, the science policy, and so on. And another one is really advocate for more representations in like conferences and meetings and so on, so that the discussions that really includes the IPR perspectives. So through obviously hope to work on to really create more forums and opportunity to foster this kind of discussions and collaborations, really to address some of the key challenges we just mentioned earlier. And that's relevant to the Indo-Pacific regions. It's an interesting thing whenever I heard people from Indo-Pacific regions mentioning, oh, this is very unique to us and things like that. And then when I actually have conversations with people from other regions, and then you soon realize, yes, we probably have in the details, we have very specific needs, but on a high level, a lot of the challenges were quite similar, even though we are different regions. And feel free to come to me if you have any ideas and so on. Again, I'm here to facilitate and to connect everyone. So feel free to reach out through, I mean, we have a very good ABNA platforms here, but also ISBER probably work both together. So feel free to reach out to us, either myself or any of the regional ambassadors. If there's any other, I don't know whether there's anyone from other countries, but yeah. Obviously, with talking about conference and stuff, again, another advertising slide is to say, yes, we managed to bring ISBER here in Melbourne next year. So really excited to hope everyone will be able to join us. I mean, this is probably the nearest could get. This time, especially for the Australasians, but also the probably more accessible for some of the Indo-Pacific region people. So I think we'll probably have more representation, I would say, this year in this conference. So if there's any questions, obviously feel free to reach out about this. I think the abstract opening is already out. I think it's due in November, and even the roundtables and workshop. So please feel free to put in your calendar, and then also submit abstracts or roundtable discussions. So I think most of you who have attended ISBER will agree that the roundtable is really amazing, because you just never know who you interact with, and then create a very good conversations and leading to publications or some research around the topic as well. With that, I would like to thank these people very quickly. So the ISBER and the head office, the regional ambassadors that work with me, the biobankers around, especially those who provided me the input, the ABNA, of course. Alison Joan Parry, who is the president, and she's also the person who introduced this idea of the regional ambassador. And obviously Dan Catchpool and Cole Furuta, who are both the previous director at large, so I'll have a lot to learn from them as well. And as I mentioned, we have the ISBER Local Enforcement Engagement Task Force. So a lot of events that you're going to see in the Melbourne meetings will be from this group. And responders to the interviews and survey, and also obviously my own team as well. Obviously, thanks Jenny for invitations as well. Thank you.
Thanks, Wayne. That was a great talk. Really interesting. I think, yeah, really excellent overview of what's quite a complicated landscape. The Indo-Pacific region's a diverse range of countries, but I think you showed really clearly how we've got while there's some specific sort of issues in those different countries, a lot of our issues are quite generic. So look, I would like to, if anybody has a question or a comment that they'd like to make, please either pop it in the chat or just raise your hand and I'll call on you. I was going to just, in the meantime, I've put something into the chat to let people know that ISBER is coordinating some educational webinars. I'm actually chairing that group. We have a webinar coming up this week. I would say though, I think, Wayne, it was really interesting that you showed the ISBER membership. That's something that I've never really understood, but certainly you can see that the membership is really overwhelmingly, sort of North American. And I would say all of our educational webinars are all happening at times that are good in the US and they're pretty bad here.
Yeah.
But all of our webinars will be recorded. So if you can't attend, you can see them and they are free. And I think that's one thing that I pushed for very hard, because I know that often biobankers don't have the resources. They can't afford to pay for education, and particularly if there already is for members, things need to be free. So these educational webinars will be free. I guess I've got a couple of questions. I'm just trying to remember my questions now, but I think, yeah, I guess one of the questions is around that whole issue of ISBER being, when you've got any organisation where the majority of the members come from one area, it is challenging for the members who are in the minority. Do you have any kind of thoughts around that, around what we can do there?
Yep. I guess the first step, like you said, I was very surprised to see that indeed that sort of stats is actually in the annual report. So when I first joined to be a director at large, I was like, how many members do we have in this region? Is to really, I think the really kickstart is to at least know that that's a fact. Why is there a fact? And some of the I think the real factors are really around, the cost of the memberships and the engagement in a way that, a lot of time is really, oh, I'm attending conference, so I'm going to sign up for that sort of membership. And I mean, one of the good things that ISBER really done, which may be sort of affecting that sort of sign up as well, is the best practices has always been free, but it's probably one of the most widely used resources, not just in North America, but it's across the group. And what I was very impressed is the editor. I think the whole editorial group is actually very diverse. So at least from that sense, the sort of and scientific input is actually very diverse. I guess is the constant advocating like what Jenny, you really did well in that sort of pushing that sort of training and webinars and making those a bit more online friendly kind of things would really help in that sense. I think one of the issues we need to address in the strategic plan that's coming up is really on that. I think also the language and that sort of confidence in the culture is very different as well. So another area I think is like sometimes also because there are already some networks like ABNA and so on in the region. So instead of trying to reinvent the wheel, I guess is really working closer with them to see how we can help and work together. I think one really good interesting findings that I kind of do some studies in that is really we have really good networks in these Indo-Pacific regions to already working together. So I think really working with partners is one of the key, I would say, to improve that. I mean, another area is, I guess, is still that cost. So really probably advocating on how do we balance that out. I think ISBER is doing, we're trying, because one of the things is truly provide a cheaper membership cost and so on for the low and middle income. It's then further on how do we actually make this even better in that sense.